Hi, everyone. My name is Dr. Rob Swanda, and I'm really excited today to initiate our Carbon Health partnership with bringing questions that you have from the community to different physicians and their specialties to get answers directly to you. And today I am joined by Dr. BCW, a physician and medical director at Carbon Health, who is a fantastic science communicator, and in the past few months has been using that skill to educate the community about an emerging outbreak known as monkeypox. So, Dr. BCW, what even is monkeypox?
Well, thank you, Rob, for having me on. I'm so excited to answer people's questions. So when we think of monkeypox, I always like to talk about it's a virus that can infect anyone. And so this virus is transmitted through skin-to-skin contact, as well as respiratory secretions. And so when you think of that, you have to really think about, utensils, sharing a meal, kissing, hugging, any sort of close contact. That's the way this virus transmits. And so I'd love for you to share some of that historical context that we know about monkeypox.
Yeah, so this disease was actually first found in monkeys, which is where it got its name, back in around the 1950s. The first case of it actually being found in an individual wasn't for a few decades later, and it's really been centralized in Central and Western Africa, which is where it's been spreading, endemically, and it's had a couple outbreaks here and there where it's been found in the US, it's been found in the UK, but those were just a few cases and they were contained. And it was primarily due to some individuals who were traveling to these regions, or it was due to animals being shipped from those regions to these different locations. So it's really not been outside of the continent of Africa for a long time. And now we're beginning to see a lot of cases outside of the continent of Africa. So, what are some of the symptoms that individuals may want to be on the lookout for monkeypox?
So this virus has several symptoms, such as fever. You might feel tired, body aches, as well as one important distinguishing factor is swollen lymph nodes. And so often that area could be, whether it's like under the saliva, under the tongue, or in the neck area, as well as in the groin area. And so that's one symptom to really hang your hat on. Other symptoms, such as, of course, the rash, which is kind of the biggest thing that everyone has been talking about. It's important to know that you may only have one pustule or one kind of presentation of the rash, as well as you do not have to have all of the symptoms to technically have monkeypox. So that's why I really encourage, people to go in and get checked. If you think you have any symptoms or possibly exposed, it's well worth it to go in and get checked out.
That actually leads to a great question from one of our audience members asking, is testing for monkeypox becoming more prevalent? And what's usually a typical turnaround time if somebody did go get tested? Will they find out in a day? Will they find out in a week, a month? What does that look like from your standpoint as a physician?
So right now, what we're seeing is, as far as a turnaround time, it's taking about 2 to 5 days, depending upon where you get tested. An important thing to know, the only way that we can actually check for monkeypox or truly diagnose it is through a scraping or, kind of just an area of the lesion or rash. And that's the only way we can truly diagnose it. However, even if you don't have, a rash, I still encourage you to come in and be examined, because this virus really looks like so many different viruses out there. And so if you have a fever, if you're feeling tired, or just not yourself, it's well worth it to go in and be seen. So don't feel like you have to have a rash to get checked. Just go in and just make sure that, everything is as it should be by seeking out either an urgent care or family medicine doctor.
And what does some of the preventative measures look like right now for monkeypox? So I know a lot of things in the news have been talking about of the vaccines and even vaccine equity. And, that's what a lot of the audience was asking about was, who should get a vaccine, or can I get a vaccine? What's the, current status of the monkeypox vaccine that you've experienced?
So right now, there has been a true delay in being able to get the vaccines. And so as a physician, it's really been hard for all of us because we want to give that care to our patients. And so currently the eligibility criteria is if you've been exposed, if you're considered high risk, whether you work in a healthcare setting or considered in a specific orientation, such as men who have sex with men. That is the current criteria. However, I am big on equitable care and access, as you know. And so I am sharing that if you have been exposed, it does not matter what your sexual orientation is. You should come in and be seen and be evaluated, because it's important that you are checked out. Because when we think about this virus, or any viruses for that matter, transmission can happen when you don't have a chance to know your status. And so it's important to go in, be seen, seek out a public health, a site, or urgent care or family medicine. But the best thing that you can do is, if you think you've been exposed, it's really important to get checked out, because we do know that the vaccines have this amazing opportunity to possibly prevent or decrease the symptoms. And so getting that vaccine as soon as possible is really helpful in decreasing your risk for transmission for yourself and your family.
And I think that's one of the great things about this vaccine too. And I'm a huge vaccine advocate. Yes. And this vaccine is actually like such a traditional type of vaccine. It's not some of the newer technologies that we saw with COVID. It's not mRNA, it's not viral vector. It's really just using that weakened or dead form of a virus, which has been proven for decades to be beneficial in eradicating so many diseases and giving your body a snapshot of what the virus looks like. So it gives you this dead form of a vaccinia virus, which is part of the same family of monkeypox. And then your body kind of creates this broad immunity against other vaccinia type of viruses. So there's not just monkeypox, but there's also smallpox virus. And then for other animals, there's cowpox, there's rabbit pox, etc., that we don't really need to worry about. But still, it's a really cool thing about this particular vaccine. And that leads into a question that came from our community that I'm hoping you can touch on, because it's something I'm not as familiar with, is what is ring vaccination? As individuals, we're starting to hear this term being brought about as those individuals with the closest contact to a positive case should be vaccinated. But why does that work?
So when we think of ring vaccination, it is a measure in hopes of decreasing transmission and really mitigating, when you have a disease that's prevalent. So vaccinating those who are around someone who has been diagnosed with a certain virus or disease, it's a way to hopefully decrease that transmission amongst others or those that are close contact. So it's a great tool that has been used in hopes of mitigating specific viruses.
And another question that individuals have been asking is, are there certain treatments or medications that are currently being provided by physicians if someone does come up to have a positive monkeypox case, but they've kind of missed that window of being vaccinated?
So unfortunately, there isn't a specific form of treatment. It's supportive measures. And so what we're doing is we're really trying to find ways to decrease your discomfort. And so we know that the rash is so painful, and the areas that it tends to kind of be more prevalent in are really hard as far as just trying to get through daily life. And I give an example, such as having lesions in your mouth. It really prevents your ability to eat and drink. And so my goal, and physicians across the US, what we've been trying to do is really provide over-the-counter medicines such as Tylenol and ibuprofen in hopes that we can decrease that discomfort, as well as help the other symptoms that are sometimes associated, such as fever, and body aches. Now, there is a specific antiviral medicine called TPOXX. And so currently, providers are really having a hard time getting this medication. There are several barriers in place at this time that really prevent us from being able to just get it to you as quickly as we would like to. And so our hopes are that the government releases this sooner so we can help more people in a more efficient manner. And so I will go ahead and have you talk about how TPOXX, really came about and its amazing effect on monkeypox virus.
Sure. So TPOXX was actually studied for use in the smallpox eradication program, or when smallpox was infecting a lot more individuals. So that's when it became more prevalent and individuals were really trying to find relief for these individuals. I mean, smallpox had a much higher death rate, so getting individuals some type of treatment was extremely important then. And it essentially blocks one of the proteins that the virus needs in order to move from an infected cell to a healthy cell. So viruses are made of proteins, just like we are, just a lot fewer, and they use our bodies in order to essentially make a virus factory. So it needs our cell as a host. So if we can stop it from moving from one cell to another, it gives our bodies a bit more time to clear out that infected cell, get rid of that virus that was inside, that infected cell, and then hopefully allow it to mitigate some of the symptoms that individuals have been experiencing due to these vaccinia type of viruses. And again, that was all studied in smallpox, but the effects have been seen also for monkeypox. So it really depends on the area that an individual lives in. In the US, currently, it's not FDA approved in order to treat monkeypox, but it does fall under that emergency use authorization. But in other countries, such as the European Union, TPOXX is actually approved for the treatment of a variety of vaccinia type of viruses, including monkeypox as well.
And one thing I always like to share, all medications, yes, medications can help, but they do come, with some side effects. So I like to share that they've had nausea, diarrhea, stomach pain. So it's important that I share that information because there isn't this one fix all kind of treatment for monkeypox, that sometimes the treatment can cause side effects as well.
True. That's a really great point. I'm glad you brought that up. A couple of viewers have been asking us if this monkeypox outbreak could be the next COVID-19 outbreak, as we're entering into year 3 of having COVID-19 around. Is monkeypox going to be as prevalent as we saw COVID-19? Is it going to come in waves? I think that, there's a lot of unknowns. We don't really know all the answers right now, but I'd love to hear your thoughts, Dr. BCW, on, comparing and contrasting COVID-19 and monkeypox.
So, as you mentioned, Dr. Rob, there's a lot of unknowns when we talk about monkeypox. I am hopeful that it does not become something such as COVID-19. There's a couple of elements in there that really help when we think about it not becoming COVID-19. Number one, we know about this virus. We have known about monkeypox versus COVID-19 was quite novel. And we didn't know, how to really even prevent it, treat it. And we were just trying to figure it out as we went. Versus monkeypox, we have this database of information that we can use immediately. So that, number one, really helps combat this virus. The second thing is we have vaccines, which is part of that toolbox, that playbook that I just mentioned. And so, and another element that makes it so special is, as we talked about before, it could actually prevent it. And so that's a huge thing different than COVID-19, where you were taking that vaccine in hopes of preventing it, or more like reducing the symptoms, because we knew that the vaccine couldn't prevent it 100%. And so with monkeypox, we have the opportunity to possibly, prevent it, especially if it's given close to day 4 within that 4-day period. And if we go up to 14 days, there's still that prevention as well. Another important piece is we have found that it's not airborne. And I think that's another important part in really kind of being able to mitigate this virus. Yes, respiratory secretions, and we can find it on objects and so forth, but COVID-19 is associated with airborne transmission. So that is a big part of a differentiator when we talk about monkeypox and COVID-19. So we are lucky this time.
Yeah, true. And I think, that leads into a pretty good question too, where somebody was asking, would face masks that were effective at preventing the spread of COVID-19 be effective at preventing the spread of monkeypox? And I think it's important for individuals to recognize that COVID-19 is not gone. SARS-CoV-2 is still circulating, some regions now more than ever. So, when we think about face masks, we're not really just thinking of one disease or one respiratory illness that we're able to impair or put a little bit of a hurdle in terms of its transmission. It's really a broad spectrum of these different respiratory diseases. But what's your take on face masks and monkeypox transmission?
I love that you said that. We have to remind ourselves that there's so many different, I call it kind of crossovers of different viruses, and when we talk about face masks, yes, it can be protective, but we really have to kind of break it down to what are we trying to prevent. And so when we talk about monkeypox and its transmission through respiratory secretions, it's really that kind of close contact, such as a very intimate face-to-face contact. And so wearing a mask, if you have sores in your mouth, or if you're going to have long-term intimate face-to-face contact with someone, yes, it is possible to transmit it, but you could also transmit other things such as a cold and other viruses. So I am one who states, if you are in a situation where you might be exposed to someone with monkeypox, or if you are feeling ill or possibly have symptoms of monkeypox or any sort of kind of feeling under the weather, there's no harm in wearing a mask and, number one, protecting others. And so thinking about that when you decide, should I wear a mask, should I not? I think that's really helpful when you make that decision.
Yeah, that's beautifully said. I completely agree with that. And as we saw, more and more cases of COVID-19, of course, that's when our hospital systems began to become full with patients suffering from COVID-19 and a SARS-CoV-2 infection. And some audience members are wondering, is that something that's possible for monkeypox, or not as much, as we really haven't seen deaths associated with this condition in the current outbreak in the United States?
So although monkeypox is rarely fatal, we have to look at the complications that can happen from it. And I think that is a big part when we talk about hospitalizations and worsening symptoms. And so those patients who have monkeypox, when they have sores in their mouth or in other areas, it can be prohibitive of being able to eat, drink, use the restroom in a way that you are not really experiencing pain. And so why does that matter? If you're not eating as much or drinking water or fluids, you actually have an increased risk of becoming dehydrated. And that can cause your organs in your body, such as your kidneys, to shut down. And when that happens, that is the increased risk of being hospitalized. And so those are the elements that you want to think about as far as monkeypox and the potential to have, sheer numbers or large numbers in the hospital. If it happens, it's going to be from those types of complications, which can happen from other diseases and viruses and so forth.
Yeah, being on the lookout for those secondary complications is so important, and I think very much often overlooked. If somebody sees a condition of monkeypox and they really only associate it with those sores and maybe some discomfort, but not necessarily some of these other things that can arise if that's not being communicated to the community. And
exactly. And, when you think about patients who have underlying health conditions such as diabetes or other, conditions that really need consistency with fluid and food, that can really exacerbate a disease such as monkeypox.
Right. And that is, what some of our audience members are also worried about. Some of them do have some of these other underlying conditions, whether that's immunocompromised or they have recovered from a certain type of condition, maybe a cancer, and they're wondering, where does their status lie in terms of vaccination? So somebody used the example of that they were able to receive the COVID-19 vaccine a bit earlier than the rest of the other general population or the healthier population. And do you foresee that being the case for monkeypox if we're able to get more of the vaccine, of course, distributed, because that seems to be the biggest barrier right now.
Well, I hope so. And I'm going to be one of many, I'm sure, healthcare providers that are going to advocate for that. Because one of the things that I keep mentioning, this virus is not discriminatory. Mm-hmm. And so when we really think about that, we have to find a way to provide vaccinations to everyone, because it is so important that we don't segment this virus into a specific population and cause more complications, possibly death or other factors, because we didn't provide full access to everyone who would like to have this vaccine.
Right, so true. And there was individuals who received smallpox vaccines several decades ago, and they had questions of, is their vaccine against smallpox still going to be effective against monkeypox? And for me, I think, that's a pretty big unknown. We really haven't had to look at those type of infections in so long that it's likely that you may have some protection still. It's not that protection usually doesn't just 100% disappear, but the amount of protection that one has, is that enough to combat a high level of, community spread or viral load that is currently out there? I'm not sure. And I think it's better to be safe than sorry if you are able to receive the vaccine and there is some available in your area.
I agree completely. It's better to err on this side of safety. Mm-hmm. And the fact that we are so fortunate to be able to have something that could prevent this disease is an amazing gift. And so if you have been exposed, and even though you've been vaccinated in the past for, smallpox, I agree with you. I think it's well worth it for protection for yourself, your family, your friends. Go ahead and get vaccinated.
So we have a few more questions from the audience that are a bit more specific. So the first one is really asking, if an individual has monkeypox, are they likely that they will get scarring from some of the rash or the lesions that they receive due to the infection?
So unfortunately, it's quite possible. We are hearing about cases where people are getting, are permanently scarred. And so this is a possibility. Of course, we hope that doesn't happen, but I have heard and seen patients who unfortunately have had permanent scarring.
And following up on that question too, for communities of color, what does the monkeypox symptoms look like for them?
Thank you for asking that. So when we talk about the rash, it's really important that we highlight that a rash in someone of color actually sometimes can appear darker. And when we hear the term, oh, it's red, look for red symptoms, actually it might not appear red. It could actually be more of a subtle look. And so it's important that we recognize that people of color, the rash is often not as red and it's often darker.
And then for our community members too, who have children, some of them have been concerned with, what could monkeypox look like in terms of spreading amongst kids? Do you have any experience, talking with individuals about that, or even your own experience of how you're able to keep your own kids safe?
Yes. So as a doctor and a mom of two little ones, we are all, slightly worried about our kids actually getting this virus, and especially with back to school. And so it's important to remember that we do have things that can help prevent it. And it's not just for monkeypox, it's for all viruses. So hand washing. I said before COVID-19, before different pandemics, hand washing was important. So it's something that we know how to do. And so we have to continue that measure, as well as wiping down objects, toys, and so forth can be very helpful in preventing the spread when we talk about schools or any place.
And then, as someone who works for Carbon Health, have you been administering the monkeypox vaccine at all, or have you been in touch with individuals who have been able to vaccinate individuals for this disease?
So at Carbon Health, we have always been at the forefront, and we believe in quality care. And so how do we do that? We reach out to public health and we find ways to be able to get the vaccines to our patients. So we welcome you to come into our clinics or seek out care through virtual care. And we'll be providing a link to share more information about all of the great services that we have, whether it's vaccinations or traditional healthcare such as primary or urgent care. We're here for you.
Yeah, and that is great. So for our listeners who are watching or even just listening in, you can find the links to Carbon Health's website below, so you can schedule some type of virtual visit or an in-person visit if it's available in your area, and just learn more about what Carbon Health is doing, not only for monkeypox, but also for a variety of other health concerns. So with that, this wraps up our first Carbon Health promo with a healthcare specialist. And I was so excited to be joined by Dr. BCW today to answer everyone's questions about monkeypox. So Dr. BCW, could you just tell our audience where they can find you so they can learn more about the great information that you're putting out to the communities?
Well, thank you, Dr. Rob. You can find me on Twitter at Dr._BCW, as well as on LinkedIn and Instagram. And please reach out. I love advocating for healthcare, health inequities and disparities, and raising awareness of what we can do to move the needle in healthcare and deliver a better form of healthcare moving forward. Thank you for having me.
Yes, we are so happy, and I'm sure we will see you back here very soon. So everyone, just stay tuned for our next announcement on what our topic will be for session number 2, and we look forward to talking with you then. So thank you.
I'm excited.
Yes. All right, we'll see everyone later. Bye.
Bye.